In tonight's Health Edge, toxicology tests show Prince died from an accidental overdose of the opioid fentanyl. It is raising bigger questions about prescription drug abuse and how easy it is for people to get their hands on narcotics.
We want to bring in our chief health editor, Dr. Partha Nandi, now with a closer look at this epidemic. It's so serious.
Yeah, it's one of the biggest problems that doctors like us face. You know, the drug fentanyl has killed Prince, and as a narcotic that's so powerful, it's causing a wave of overdoses and deaths, likely as a result of illicit drug manufacturing. Now, the abuse of prescription painkillers continues to grow in young adults and youth. It really is a big problem for us. We really need to educate ourselves and our loved ones about the dangers associated with drug use.
What is fentanyl?
Yeah, a lot of people don't know. It's actually a powerful synthetic opioid. Opioids now are a class of drugs that include pain relievers, and fentanyl is the strongest opioid approved for medical use and is more potent than morphine. It's often used to treat those with severe pain or to manage pain after surgery, so really legitimate reasons to use it.
But what happens, you take it for legitimate reasons and you can end up addicted to it. So what makes it so addictive?
That's a great question. So fentanyl drives up something called dopamine levels in the brain's reward centers and produces this intense state of euphoria and relaxation, also known as they get high. Repeated drug abuse over time can affect a person's self-control, and they can experience intense impulses to take more of the drug. Over the last few years, there's been a dramatic rise in prescription misuse or abuse. I'd like to make it known that drugs are effective when taken as prescribed and rarely leads to addiction or dependence when used for the short term or under a doctor's cautious supervision. However, prescriptions from dentists and physicians can lead to dependency and addiction if not used properly.
What's your recommendation here for how we get rid of this sort of problem?
Exactly. So here's my prescription. Number one, always follow the directions carefully. Secondly, don't change the medication dose without talking to your doctor. Also, never stop taking the medication on your own, and never allow others to take your medication and don't take theirs. Also, tell your doctor if you've had issues with substance use. It's important before your doctor gives you a medication that could lead to more abuse.
Yeah. Any treatment for fentanyl overdoses for people?
There are, but the thing is that you need to get to the hospital fast, and fentanyl overdoses need to be treated immediately with something called an opioid antagonist. So treatable, but you got to get to the hospital fast.
We've got a viewer question before we go. Frank wants to know about a superbug and what you can do to protect.
Yeah, superbug is not a superhero. We talked about this a few days ago. Superbug is this: a bug or a bacteria gets an antibiotic and it sees it and it becomes resistant, and so much so it gets resistant to lots of antibiotics. Then what happens is that the bugs become super and you can't really treat it. So how can you prevent this? Number one is that use the antibiotics appropriately, use a full dose of it, and also just wash your hands.
And use it sparingly, right? And don't
exactly.
take it every
don't
time, or don't ask your doctor for it.
That's exactly
Yeah, we've heard that for a long time. More of us need to do it. Thanks so much, Dr. Nandi.
And if you have a question for the doctor, you can email him at drnandi@wxyz.com or send it to us on Facebook or Twitter.